Provincial Health Officer, and Dr. Penny Ballem, Executive Lead of BC's COVID-19 immunization plan. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Earlier this summer, we shared news that we had started the work necessary to offer a fall booster dose. Many of us might recall receiving text on this important safety step in mid-July, when summer was just getting underway, or at least it seemed that way. And with today marking back to school, the end of summer holidays, the time of year when we get back to it, we're here to announce the details of the fall booster campaign. It's a welcome step that builds upon previous efforts and advances, especially Health Canada's news during the summer that it had approved a pediatric COVID-19 vaccine, a booster dose for children ages 5 to 11, and on September 1st, approval of a new booster dose, a bivalent, one that Dr. Henry will talk about in a few moments. For all of us, with COVID all around us, it's been a busy summer. British Columbians have continued to protect ourselves, our loved ones, and our communities by getting vaccinated in record numbers. As of August 15th, 92% of people in BC aged 12 and older had received the two-dose primary series, and more than 12 million COVID-19 vaccines had been administered. We started offering the pediatric vaccine on August 2nd, and 2 weeks later, 20,000 children had registered to get their shot. And I again ask parents to register their children today. Getting our vaccines and our boosters for ourselves and our children have protected us against severe COVID outcomes requiring hospitalization, which has eased COVID stress on our healthcare system, a stress that continues nonetheless to exist. 15,800 healthcare workers in the last week where we have information, which is the week prior to the week ending in Labor Day, were off sick that week, significantly above the usual numbers, and that has an impact everywhere in our healthcare system. Put simply, when we get our vaccines and our boosters, we save lives. It's vital work getting our vaccines and keeping up with our boosters. And our ongoing commitment to this effort has made and will continue to make all the difference to each of us in how we face COVID and how we live with COVID. On that point, we're here today to provide an update on our fall booster campaign. And I now invite Dr. Bonnie Henry to talk about the fall season and how we can continue to protect ourselves. Dr. Henry.
Thank you very much and good afternoon. I want to start by talking a little bit about where we are in this pandemic and what we all need to think about as we start back to school and work for many people and head into the respiratory illness season this fall and winter. We still have a very uncertain trajectory of the pandemic in the next few months. And while I do believe we are emerging from the pandemic part of it, it is clear that COVID-19 will be with us for the long term. It is still, in my opinion, though, an unusual event, one for which we need to continue to take coordinated measures together. We know that we, for example, still have our special advisory committee nationally. The WHO has still called this a public health incident of international concern. And we know that there is still significant spread around the world, and the public health impact of the emergence of potentially another variant of concern is still one of the uncertainties that we have to live with right now. But we do know more and more about the virus and about how we can manage both individually and collectively in this province. But we are not yet at a point where we can let our guard down, both here and globally, and the public health emergency that we have here and the measures that enable the measures that we can take remain important. We also need to continue to pay attention to the things we know will help against COVID-19, and also in the context of what we may be facing in the coming respiratory season, things like influenza, RSV, and other serious respiratory illnesses. So while my team have been working a lot through this summer to try and give a sense of what we might be facing in the fall and winter, and we'll be talking more about that next week, We do know that the COVID climate, the climate that we're in, gives us a sense of where we are in the pandemic. And it's measuring things that we provide information on, like rates of illnesses. We know that that is focused on the people who are most likely to need treatment or to have interventions as a result of their illness, the PCR testing. But also on hospitalizations, ICU cases, people who end up dying from COVID-19. And we also look very closely at outbreaks in long-term care homes, in assisted living, in schools, now that kids are back, and other surveillance markers like wastewater testing, seroprevalence studies that we're doing on an ongoing basis. And those all give us a sense, a picture of what's happening in our community over time. Those are not things that change on a day-to-day basis, but they do change over weeks and months, and that's why we provide the weekly information that we have been providing. And we've been working on, and we'll give, as I mentioned, some details next week. But we also need to look at, what is the weather on a day-to-day basis? Like we would look outside and say, yeah, it's summer, so are we expecting sun or rain? Do I need sunscreen or do we need my umbrella? And when we look at that from a COVID perspective, it means looking about how am I feeling today? If I have a cough or a fever, then maybe I need to stay away from others. What am I going to be doing today? Am I going to be in a crowded place with lots of people? Maybe I need to take a mask with me. What's happening in my community, that COVID climate? But also looking at the things that I can do to see if I'm okay today. And that is staying up to date on my vaccinations, making sure that I'm cleaning my hands regularly, covering my mouth when I'm coughing, staying home if we're not feeling well. And the things that we need to think about now are not the same as the ones that we thought about over the last couple of years, where we didn't have the level of immunity that we have now. But things that are indicators that we may be infectious to others are things like having a fever and a cough. Fever and a rash, those are things that are from our past that we may remember. Having nausea, vomiting, diarrhea, those are things that can be infectious to others. And we're likely to see more of those as we go into this fall season. So I need to think about what am I doing? What setting is it going to be in? If there's lots of COVID or even influenza circulating, maybe I need to stay away from high-risk settings if I'm at risk myself, or if I'm not feeling well, postpone that visit to somebody who's going through cancer treatments or to visiting your grandmother in long-term care until you're feeling better. Those are all the things that we need to think about on a daily basis as we're going into this fall and winter. And of course, cleaning our hands regularly and staying up to date on vaccination. It is without a doubt vaccination that has allowed us to get to this point where we no longer need to have broad imposed measures like mask mandates, like closures, like distancing, that we know are so disruptive to society, and that we needed to slow the spread of SARS-CoV-2 when everybody was susceptible and we knew that severe illness could happen to large numbers of people. But because so many people have stepped up and received their immunizations, we are in a very different climate now than we were even just a year ago. The level of immunity that we have from infection and vaccination has been a game changer. And we know the virus has changed as well, and that has changed what we've had to do. But we need to keep it up to be certain we are protecting those most at risk and protecting our healthcare system in the coming months. I'd also like to talk a little bit about immunity against COVID-19. So immunity can mean a lot of things, and many people think of it as an all or nothing. But our body's immune systems are complex, and we've talked about this quite a few times. Immunity is our body's ability to protect us from getting sick, getting infected in the first place, but also getting sick or seriously ill from a pathogen, an agent, such as a virus, such as SARS-CoV-2. And we have learned over this last 2.5 years a great deal about COVID-19, the illness, about SARS-CoV-2, the virus, and about immunity. Since we've had vaccines as well, we know our immune system is complex and responds both to vaccine and to infection, and that immunity is not just on-off, It can be different in different ways, and it's not just one size fits all. We know that an infection-induced immunity, what some people call natural immunity, is the immune protection we get when we're infected with the virus. Whether it's the original strain, the Delta, the Omicron, it gives a different level of immune response. And I've talked a number of times about we have two main parts to our immune system, and one of those is the antibodies that are generated when we're infected with a virus. And those antibodies are in our blood, and over time, those go down. But the second part of our immune system is our cell-mediated immune system, and those are those memory cells. They have great names like killer cells that remain in our body, and when we get exposed to that same virus again, they can come up and protect us from getting really seriously ill with the virus. That as many as 1 in 8 people, and this is from data that was done here in Canada and also in other parts of the world, who are infected and don't infected but not vaccinated. So people who have only infection, whether it's from original Wuhan strain, from Delta, from Omicron, well, 1 in 8 people don't develop a protective immune response. So they may have antibodies for a short period of time, but those may fade away, and they may not have stimulated that stronger, longer lasting response from the cell-mediated immunity. And we know that this immunity decreases over time and is different with different variants. And we see that particularly with Omicron, that if you have a mild infection with Omicron and you don't have your system primed through vaccination, that you may not develop seroconversion or enough of that strength immunity so that you can more likely to be reinfected, you're more likely to have more severe illness. We also know that vaccine-induced immunity is also complex. And when we know now that it gives strong protection against any infection after 2 doses, but it's better after 3. So really 3 doses is important for longer lasting, stronger protection, both from those antibodies, which also fade over time, but that stronger cell-mediated immunity that we now know from the vaccine effectiveness studies done here in BC, done in Canada and elsewhere, that it gives you longer lasting protection against severe illness, and that is preserved for many, many months and years. For some people, we also know, we've learned, that if you're older, if you have certain immune compromising conditions, you may need more vaccine, and your immune system tends to decrease that protection sooner than people who have a good, strong immune system. So we need to protect those people with additional doses when we see surges in transmission in the community. We also have a new thing that we've come to understand a lot more, and that we've now learned that there's better and sometimes longer lasting protection with hybrid immunity. So when somebody is both vaccinated and has had an infection. This is especially true now with the Omicron, where we've seen lots of infections, and I think everybody knows at least somebody who's been infected this summer. But those infections have been mostly mild because we've primed our immune system. It stimulates those antibodies, it stimulates those cell-mediated immunity. So even people who might have had a severe infection before, their immune system is able to recognize the virus and protect them in a way that we haven't had before. So what does all this mean? With vaccination and with hybrid immunity, we now know that there are far fewer people in our community now, today, who are at risk of severe illness from COVID. And we have tools now to top up immunity for those people who are still at risk, and that includes the newest approved bivalent vaccine booster. In addition, we have treatments that can be used for people who are most at risk if they do get infected, including things like Paxlovid and Sotrovimab. So the new bivalent vaccine is a combination vaccine, and we use multivalent vaccines. Bi is just means 2, so this one has 2 different proteins in it. These types of combination vaccines are actually very common. The most common one that people probably know very well are influenza vaccines, and influenza vaccines have 3 or 4 different strains of influenza in the one product. We also have polio vaccines and pneumococcal vaccines that have multivalents in them as well. So Every year, we know that scientists combine activity against a number of the recent strains of influenza, for example, and that is included in the latest vaccine. So this is very similar to what we're doing now with COVID. As you know, last week, Health Canada approved the use of a combination bivalent COVID-19 vaccines. It's approved for use in adults 18 years of age and older, and I'll talk a little bit about that in a minute. So this is a form of combination vaccine that has the spike protein in it, not just for the original Wuhan variant, but also for an Omicron variant. And it is based on the Omicron BA.1. But clinical studies have shown that that BA.1 component of the bivalent vaccine stimulates a very strong immune boost against all of the Omicron strains, including BA.4/5. So that's important. I know the US has approved a bivalent vaccine that includes the BA.4/5, a more closely related one. But in Canada, the one that's been approved with all the data that we have is the one that's bivalent with BA.1. And that in the clinical studies has shown to give a really strong increased boost against all of the Omicron subvariants. So I think that's important for us to recognize. And so this version, as I said, was designed against the BA.1, and we know that it is BA.4/5 that we're seeing most commonly now, particularly BA.5, but it's not a dramatically different strain. It's not a new variant. It's not a new variant of concern. It's still within that Omicron, and so we're seeing good protection. It also protects against infection. So that's the part with the antibodies in your blood that we see decreases in all of us the most. And there's lots of good reasons for that. We know that the protection lasts best in the first 8 to 12 weeks after you get your booster shot. That's important because as we're putting all of these pieces together for thinking what might happen in the coming weeks and months, we want the people who are most at risk to have that boost up, that top up of their protection so that they have antibodies to protect them from infection when we expect to see COVID increasing again. And as I said, we'll be talking some more about that, but what we're looking at is probably November, December. And the other things that we're putting into the mix is it's very likely we're going to see influenza this year. And we haven't seen influenza in the last couple of years, but people are traveling more, we're doing more together. And we look at what happened in Australia, New Zealand, we see that influenza was a fairly bad season this past year for them, and it came early. So what we're planning for and what we need to think about is how do we best protect people from influenza, from COVID, at a time where they both might be circulating, and that is really November, December. So that's a little of the thinking that's been going into who's going to get this bivalent vaccine booster and when. So the timing will be based on risk and on the time since your last dose. So first of all, we need to know who are the people most at risk for poor outcomes from COVID-19, and I think this will be no surprise to anybody. We have learned that there are people whose immune systems don't respond as well and decrease faster, and primarily that is people who are immune compromised due to underlying disease or due to the medications they're on, and people of older age. So it includes people being treated for cancer, people with chronic kidney, liver, lung diseases, pregnant people, and those and a number of other disorders and medications, and people over the age of 60, particularly over the age of 80, but we really want to protect people over the age of 60. And NACI recommends, so our National Advisory Committee on Immunization has put out their statement on who should get a fall booster. And it's based on people who've had their vaccine for 6 months or more, their last dose was 6 months or more. And although there's some leeway there depending on circumstances, but at least 3 months since the last dose. And for some people, and Dr. Ballem will get into some of those details, we may want to give it prior to 6 months, like if we have a local outbreak, or so that we can do residents of a long-term care facility, for example, all at the same time. The other group that we now need to look at is people who have hybrid immunity that I talked about. And people should wait at least 3 months after having an infection before you get your next booster dose. That allows your immune system to mature and to develop that boost from the infection as well. I think it is also very important to say to people who are not vaccinated, even if you've had an infection, we know you are at higher risk of being reinfected and higher risk of having more severe illness if you're reinfected. So you should be vaccinated on top of having had an infection, whether it was Delta, whether it was in 2020, or whether it was recent from Omicron. Immunization will help develop a stronger, longer-lasting immunity, and you are eligible for your dose 1 today, and I encourage anybody who's not been immunized to go out and get that vaccine now. In terms of the bivalent combination vaccine, the following people will be offered around 6 months. So people, residents of long-term care facilities, assisted living, homebound, and other congregate living settings for seniors, older age adults, age 60 and up, people who are what we've described as clinically extremely vulnerable, and we have 3 groups of those in BC, and particularly those aged 12 and up with an underlying medical condition or disability, adults, people who are First Nations, Métis, or Inuit, or from those communities where infection can have disproportionate consequences, residents of other congregate living settings like migrant workers, shelters, correctional facilities, and everybody else should consider getting this fall booster. And I would say you should think about getting this at the same time as you get your flu shot, because that will give you the best protection as we head into the highest risk period. I will say that some of the long-term care facilities, if you remember, many of the people who are recommended strongly to get this bivalent dose are people who were eligible for a dose 4, a second booster. And when we get to October-ish, that'll be about 5.5 months since we started that 4th dose program. So they'll be rolled into getting that vaccine then. And that, we think, will give the best possible protection for all of us as we're expecting to see a surge of COVID in the November-December timeframe. So as we are beginning this fall respiratory illness season, we need to do so with the best protection we can. If you've just had your booster, it's okay to wait 3 to 6 months to get another one. And I've also encouraged all of those who've received their invitation for a booster, who are young and healthy and haven't got that 3rd dose, to get it now. It will give you that stronger, longer-lasting protection through the fall. And I also want to thank everybody. We are here where we are in BC because everybody has stepped up. So many people have done what we've done to protect ourselves, our family, and our communities, and it's made a tremendous difference. And I'll now turn it over to Dr. Ballem, who will provide more information on when and where the vaccine will be available.
Thanks so much, Dr. Henry and Minister Dix, and good afternoon to everyone. It's always a privilege to be here to be part of this really remarkable effort to bring our lives back to normal in the midst of a pandemic. What I'd like to do is just walk you through some of the specifics of how this fall booster program will proceed, and I'll just catch up on a few things just on our activity over the last 6 months. Over this time, the vaccine program, really since the peak of the first booster program, you'll remember that started in November and carried throughout January. And since that time, we've continued to offer vaccines for people who come to us with whatever dose, no doses, dose 1, dose 2, a booster. We've had a lot going on, and we've continued to deliver the program through pharmacies and through the health authorities. On average, about 85% of the vaccinations that we've done over the last 6 months have been done in our pharmacy sector, and I just really want to do a shout out to them. They've really done a remarkable job in coordination with the BC Pharmacy Association. And the health authorities have done the rest of the job, and they have a harder job to do. Their job is to do the outreach for people who are hard to find, people are frail, elderly in facilities, homebound people, frail people who are not able to come out to a clinic. So they have a hard job to do in terms of the numbers, not such a high volume as the 600 or so pharmacies who have continued to provide vaccine. And the health authorities have also done the children's campaigns, both the 5 to 11 campaign and then the most recent 6 months to 4 year vaccination program that was authorized in mid-August by NACI. So since March 2022, we've delivered the spring booster campaign for our most vulnerable individuals, those over 70 and those who are medically very susceptible to infection due to immune suppression, and Indigenous peoples. The Moderna vaccine was introduced, as I said, for 6 months to 4 years, the Moderna pediatric. And we just, as Minister Dix mentioned, we just commenced the first booster for children 5 to 11. So today, all individuals 6 months of age and over are eligible for vaccination against COVID. And we, from 5 on up, as you'll see, are all eligible for a booster this fall. And we really want to just put in, this is the first day of school. Children across the province are returning to school, and it's very, very important that as parents and families, grandparents, that we really try and ensure that those children and youth are protected against COVID. They're going into a setting where, we know they want to participate in many activities and not be home ill. And so getting vaccinated, whether they're unvaccinated or they're actually eligible now for their first booster, or they've been eligible for a while if they're youth, really want to encourage that they take advantage of this campaign, where a vaccine will be very, very available across pharmacies and health authorities. I think in the 5 to 11 age group, we are hopeful that we will pick up on our results. We have about 58%, just under 60% of our 5 to 11 group that have received dose 1, and just under 50% who are fully vaccinated with 2 doses. And just want to, just encourage them to carry on and take their vaccine as it's being made available throughout the next coming months. The importance of being vaccinated does continue to resonate with our public, who have been so enthusiastic. And I just wanted to share a little factoid with you that every day in the province, 50 to 120 youth or adults actually have stepped up to get their first dose. So making this available, easy to find, you never know what the reason is. Somebody who's among the 9 or 10% that are unvaccinated, why they'll suddenly choose to get it. But it's really important that we remain very available and encouraging and supportive to make sure they take that opportunity. And we want to encourage the 1.3 million people who got fully vaccinated but have yet to have a booster. This is the time to come in and get your first booster. It's really important, as Dr. Henry has explained. You are not going to get that same strength of protection, even if you've had a COVID infection. And we just really want to encourage that group, especially, to come and get it. And I'll talk to you about, where the different groups will be prioritized for invitations for the fall campaign. So now on to some details. Dr. Henry's talked about the new bivalent or combination vaccine. That's Moderna's product that has been approved. We were actually hoping we could say today it's arrived in British Columbia, the first tranche, but it's not quite there. But we're expecting that it's imminent, that we will be getting our first tranche of that supply into the province. And basically, we anticipate that we'll have about 1,100 pharmacies participating in this fall booster campaign all around the province, and that there will be, on any daily basis, more than 100 health authority clinics working with the pharmacies together to provide the capacity that we need to get our population, everybody 5 and up is eligible for a booster, to get them on an expedited basis able to access this booster, and hopefully as many as possible before we start getting into respiratory season in November and December of this year. The health authorities, not only will they have mass clinics, but they will also do, as I said, all the difficult outreach to populations who are, more vulnerable, are homeless, are sheltered, corrections, and as well they do the facility programs. So they will be visiting long-term care. Ideally, we'd like to wait to do long-term care for the high-dose flu vaccine that's specific for that very frail group of elderly. We hope to have that starting somewhere between the middle and the end of September. And at that point, the health authorities will move out to start their vaccinations in long-term care and assisted living. Dr. Henry's alluded to the fact that we will be co-administering influenza vaccine for the general population accessing the fall booster as soon as it's available. And normally, that vaccine arrives in the beginning of October. So we basically modeled and planned that starting probably the week of the 3rd, that we will be able to offer both COVID and influenza when you go to get your vaccination, whether it's a pharmacy that you're going to or a health authority clinic. Now, just to remind you that this new combination bivalent vaccine will obviously provide very good protection. Not everyone is eligible to receive it. Adults 18 years and over have been approved by Health Canada and recommended by NACI to receive the new bivalent vaccine. For youth 12 to 17, Dr. Henry has recommended that those who are high risk, have immunosuppression, have chronic medical conditions that compromise them, that they will be eligible to receive this bivalent vaccine. But for the rest of youth, we will offer them a fall booster using the regular vaccine that has been used to immunize them, to date with their dose 1 and dose 2. We understand that there is Pfizer vaccine that is working its way through the regulatory process, and we have had some information from the NOC, which provides us all the logistical information about delivery of vaccines, and we're hoping that we will receive some Pfizer vaccine in the coming weeks as well. That will be a bivalent product as well, but that's still preliminary and working its way through the regulatory program. So I think one of the things that everyone wants to know is, when am I going to get my invitation for my fall booster? And, first of all, we will use our Get Vaccinated BC system that I think most of you are familiar with. It's been a terrific system, and most of you have accessed it online. Some have used the call center to get some help with that, and that will continue to be the case. But we will be sending out our invitations through that system, either to your email or to a mobile number. And I just want to be clear that we recently have had an upgrade to the system that now allows you to actually go in and update your contact information, which is really important. Not everyone's like me that has had the same mobile number for 20 years. I gather people do change their number, and so it would be really important you go on the Get Vaccinated system. There's an icon you can click on and then update, whether it's your email or your mobile, so that you'll be sure and get your invitation. We will flow invitations for the fall booster campaign based on a number of variables, which are mostly direction from public health and dictate the priorities. So I'll just go through the key groups. First of all, the interval from your last vaccine is a really important indicator. As Dr. Henry has said, immunity does wane. So for those who only got up to dose 2, they are well over a year, many of them, since they've had their last vaccination. They may have had COVID in the meantime, but we will be targeting especially those very high priority individuals in those groups as early invites to the campaign. Those who are clinically extremely vulnerable. So we have 3 groups of those who are immunosuppressed, either severely or moderately, and then people who have chronic conditions like diabetes, some of the neurodevelopmental issues, chronic lung disease, a whole variety of conditions that Dr. Henry referred to. That's a second high priority group that will be invited as a priority for the campaign. Indigenous, our Indigenous community 18 and over. And then we will use the age cutoff of 60 years of age to finalize the priority groups who are vulnerable to COVID infection and to having more adverse outcomes. Healthcare workers is the final group that I just want to speak to. Our healthcare workers were a high priority when the first booster came in order to protect our healthcare system, and many of them are well over 6 months since their last dose, and we want them to be protected, as Minister Dix says, to protect them from getting sick, but also equally important from them, we need to protect our patients in our institutions and our programs. So healthcare workers are a really important group. And finally, the group of very vulnerable folks, 70 and over, and immunosuppressed, who were invited for the spring booster campaign. As Dr. Henry has said, we are going to time their invites so they'll be the first on deck in October to get the combined influenza and COVID vaccine opportunity. So just a point of that Dr. Henry's just referred to, elderly and long-term care, assisted living, homebound individuals, congregate settings who are considered high risk, other high-risk groups we know have adverse outcomes, those in shelters, congregate settings, corrections facilities. The health authorities are responsible for those. And when the bivalent vaccine arrives, they will be making plans to, along with the long-term care and assisted living sector, they'll be making their plans of how they'll outreach in parallel to the mass clinics and the pharmacy program that will be running across the province. We built a model for Immunize BC to actually project both who will invite and what we expect the uptake will be. We will be able to vaccinate at peak about 250,000 to 280,000 individuals a week. So that's about, 250,000 or more individuals will get their vaccine in any 1 week, and that capacity will remain for about 10 weeks. Starting in the middle of September, on September 19th, when the health authorities start up their mass clinics, and the pharmacies, the full tranche of pharmacies who will be participating, about 1,100, and we'll run that capacity as long as we need to as the demand is flowing. That's about the maximum that we can actually mobilize for this campaign at that rate. And then as the demand falls off, as we expect it to at the end of November, we will be basically backing off the health authority clinics and turning the program over to the pharmacies. And then the health authorities will carry on doing the difficult to reach, the facility program, and the children. At this time, as I said, the arrival of the vaccine, the bivalent vaccine, is imminent. This week, the first tranche, which is about 110,000 doses, will come into the pharmacy distributors. As soon as it arrives, it will be repackaged by them and then distributed to pharmacies around the province. The next week, we hope to get a bigger tranche of vaccine. That will be used to load up the health authorities, make sure they're ready for their start on the 19th. And we will start issuing invites. As soon as we have vaccine in pharmacies in the next few days, hopefully, we will start issuing the highest priority invites at that point in time and, allowing the commencement of the campaign. And it will be ramped up and reach peak by the third week in September. Now, we do know that there are some people who, may not want to, are not sure they want to do the bivalent vaccine. Dr. Henry's described that it's a very good vaccine with added protection against Omicron, but we continue to have mRNA, the regular mRNA vaccine, the Pfizer and Moderna available. We continue to have Janssen and Novavax available, and we really encourage people who perhaps are not sure, don't know enough about this vaccine, get your fall booster with either the existing vaccines that you're very familiar with or with Novavax or Janssen. We really want people to be protected for the respiratory season. NACI's guidance is very, very clear, as is Dr. Henry's. Getting a booster dose, regardless of which vaccine is chosen, is the most important thing for you to do this fall, especially once you're 6 months or more from your last dose. And finally, for all the parents, just one more plug for those parents of children, who are anywhere from 5 to 18, get your kids vaccinated. And, it'll be a real privilege for our team to carry on providing this program to support, the fall booster, to protect our public, keep our economy going, and make sure that those most vulnerable continue to be well protected in this province. Thank you very much. Over to you, Minister.
Thank you, Dr. Henry. Thank you, Dr. Ballem. And just want to say finally, before we take your questions, how important it is to get vaccinated. I think Dr. Henry and Dr. Ballem have made this clear. But the priority we give to it, you can sense from Dr. Ballem's briefing, that we're building up in a short period of time to the capacity to vaccinate between 250,000 and 280,000 people a week. That's an enormous effort by our pharmacy sector, and thank you to pharmacists, by our doctors, by our nurses, by other health professionals who are taking part in these vaccination programs. It occurs at a time when there are very significant demands on the healthcare system. And the fact that this is such a priority for us, and the fact that so many people are contributing to this effort, demonstrates its importance. So there are lots of good reasons to get vaccinated: to protect yourself, to protect the ones you love, to protect the ones you don't know, to protect your community, to protect the healthcare system. But there will be an opportunity to get a fall booster. I encourage everybody to get one. And I want to again thank all those in British Columbia, from people who work in healthcare, everyone in the province, for their ongoing support and effort as we deal with the ongoing COVID-19 pandemic. And with that, we're happy to take your questions.
Thank you. As a reminder for reporters on the phone, please press *1 to enter the queue. That's *1 to ask a question. Please also remember to take your phone off mute. You will not be audible until your name is called. For media in the room, please line up at the microphone provided and someone will check in with you. Please wait to be called and make sure to provide your full name and outlet. Media will be limited to one question and one follow-up. We'll be starting on the phones today. Our first question is from Richard Zussman, Global News. Please go ahead.
Dr. Henry, I'm trying to understand how someone makes the decision around getting the bivalent and the flu shot if they want to do that at the same time. Should people wait until that point in October? Will the most vulnerable be required or guided to wait until that point if they need to get a flu shot? How does that decision get made? And with such a push for the bivalent, are we not going to waste a lot of the other vaccine that we currently are providing and currently have in stock?
Yeah, so in terms of who gets what when, if you're somebody who has not had a booster dose, you should get a booster dose anytime now, and get your flu vaccine when it comes available later on in October. And we kind of titrate it, so those people who are at highest risk, who most need the bivalent booster, are going to be at about 5.5 months come October. So those are the people who had their 4th dose in the spring vaccine campaign. So it actually, you'd think we'd planned it, it actually lines up very well for them to be able to get co-administered their flu vaccine and the COVID booster. So people in long-term care, people over the age of 70. So for them, we right now, and I think this is part of what we're challenged with, all of us, is that we can't get rid of uncertainty. There's a lot of uncertainty, but this is our best guess of what's going to happen and unfold over the coming months. So if you are younger, you only had 2 doses on board, or it's been a long time, you're a healthcare worker, it's been longer than 6 months, get your COVID vaccine when it becomes available in the coming weeks. And you can get your flu shot when it becomes available later on in October. So don't worry so much about getting them together. We're trying to reserve that for those people we know need both, and where we can get efficiencies by giving it to people together. But I think we do need to recognize that if we start to see outbreaks in long-term care, for example, or we start to see surges in the community, that we will speed that up and we will change our approach and make sure that we can get booster doses regardless of whether the vaccine, the influenza vaccine is available or not. So this is our best guess right now, and as I mentioned, I'll be providing a little bit more background about how we came to those decisions next week when we talk a bit about the modeling and thinking about what might unfold over the fall. In terms of vaccines that we have on board now, they are still the vaccines that we need to give for dose 1 and dose 2 because there are a higher amount of antigen in them, and you need that to start off with your primary series. And the primary series is still 2 doses. We have also learned that 3rd dose is really important for longer term protection, both from antibodies, so protection against infection, but really important for developing that robust, mature immunity against severe illness that lasts a long time. I will also say that we have been titrating how much we get from the NOC, from the national supply, so that we don't have a lot of excess doses on hand. And Dr. Ballem's team have been working on that to make sure that we're not wasting vaccine as much as possible. We do know that some of it will be coming up and expiring in later in the fall and in the winter. So we try and as much as we can titrate the types of vaccine for the demand for those vaccines, as we have been doing for the last year and a half. I will also say that this uncertainty is something that, and I've talked about oscillations that are sort of getting smaller and smaller over time. And I do believe we are going to be out of the emergency response pandemic phase of living with this new SARS-CoV-2 virus, but we're not there yet. So what we're doing for this fall is based on what we've learned, that we're still in a very uncertain period of time. There's still a lot of transmission globally. We still have the possibility of having new variants that escape vaccine protection, potentially. I think that's becoming less and less likely as people globally are vaccinated. But those are the things that we still need to be prepared for over this coming year. I think that will emerge, and then we'll have a longer term strategy for whether we need a booster every year or whether we'll get more information about how long that protection lasts, especially the protection against more severe illness. And this time next year, I'll be talking in perhaps in a different way.
Richard, did you have a follow-up?
Dr. Henry, again, considering that the vaccination rate for 5 to 11-year-olds is so low and much lower than the older age demographics, what is the province doing to change its approach to encourage 5 to 11-year-olds to get vaccinated? And will there be any consideration being given to different types of clinics, including vaccinating at schools, a wider range of schools across the province?
Yeah, that is a concern for us. I think there's been a couple of things. Part of it is the timing of availability of vaccine for school-age children, and there's a lot of things going on this summer. I think a lot of people had experience of infection, and we've seen that in some of the seroprevalence data that we have we're just analyzing now, and I'll talk more about next week. We've seen that a lot of young people, especially school-age children, have had an infection within the last 6 to 8 months. So I think that impacts people's decisions on whether to get a vaccine or not. So now we need to say, yes, even if you've had an infection, you need to get that first or second or third dose of vaccine. And now's the time to do it because it's going to give you that stronger, longer lasting protection in that age group. And we have been working on a campaign to try and increase awareness about those things. And you'll see some of that in the coming weeks. And yes, in schools where it makes sense. So there are some schools where that will be a part of offering school-based immunization, but not all schools, because we know that local public health knows where those strategies work best and where people are able to get vaccine and access vaccine, and we'll be able to titrate that depending on the program.
Our next question is for Zhaozhu, Globe and Mail. Please go ahead.
For taking my question. Given the lack of uptake on the first booster shot, are we expecting better uptake on the bivalent booster? And what's your plan to ensure that there's better uptake?
Yeah, we actually had pretty good uptake for dose 3, but there is, as we talk about, 1.3 million people who have not had that third booster shot. And we have been trying to understand what are people's reasons. A lot of it is because they were busy or they didn't feel they needed it. But a huge proportion of people, it's because they had a recent COVID infection as well. As we know, Omicron has been spreading quite a lot. So we have heard from people that about a third to 40% of that 1.3 million people are willing to get a vaccine. They were waiting for the bivalent vaccine. So we will be targeting, and one of the things we're saying today is if you're in that group of people, this is your vaccine to get in the coming months.
Zhao, did you have a follow-up?
No, I don't. Thanks.
Our next question still on the phones is for Moira Whiten, the Tyee. Please go ahead.
Hi, thank you for taking my question. I just want to clarify, the fall booster is being recommended for people no matter how many initial shots they've had, whether that be the primary series or a third booster, first booster, or a second booster. Is that correct?
A little bit of nuance, as always with these things. I know it's complicated. If you've not had any vaccine, you need to get the original formulation with the higher antigen dose. But yes, regardless of whether you've had 2 or 3 or 4, we're recommending for people who are at highest risk and for all adults that they get this booster shot after about 6 months.
Moira, did you have a follow-up?
I do, and thank you for that clarification. Following up on Richard's question, there is a really low number of small children under 4 and under getting vaccinated. How much of this do you attribute to, the newness of the program, and what strategies are you going to be employing to kind of build trust in that vaccination program?
Yeah, I know there was a lot of parents, and I talked to many of them at some of the clinics who were just really relieved when we had a vaccine to protect our youngest children. 6 months, we know that infants are particularly at risk and can have very severe illness with COVID. Older children, thankfully, tend not to get a severe illness, but it's still important to protect them from getting sick. And we have seen a very slow start to it. We're only about 10% of where we want to be. And we've heard a number of things from parents about why they haven't yet brought their younger children. Partly it's because of timing. When the vaccine became available, there was a lot of people with lots going on during summer. So we're hoping that will increase. We've also been doing targeted outreach to families with children to remind them that we have these clinics now, the public health clinics that are available for kids. And as their younger children are getting up to date in their other vaccinations, they'll be offered COVID vaccine. And as I mentioned, we're starting a new targeted advertisement campaign to build some confidence and to help parents answer the questions that they have about vaccination for our youngest children. I don't know if you want to add anything to that. Yeah, we, it's a decision that we heard many parents are anxious to make for their children, but they have concerns about. Parents want to wait a little bit and see how it's working in other children, and we have more data now on an ongoing basis about safety, about how well it's working, about the vaccine formulation itself for younger children, and how effective it is. So I would encourage you to talk to your healthcare provider, talk to your pharmacist, talk to your pediatrician. There's lots of great information for parents on the BC CDC website, and also through the Vaccine Evaluation Center at Children's Hospital about these specific vaccines that are formulated for younger children. Yes, yeah, that's one of the things that we've been working on is making, especially the vaccine for younger children, available through a pediatrician and family practitioner offices, because we know that those are trusted sources for parents where they feel comfortable bringing their younger children to get immunized.
For our next question, we're going to go to a reporter in the room. Please go ahead.
Hi, Penny Dafflos from CTV News, and this is actually a question for Dr. Ballem. Could you just clarify, does somebody need an invitation to get the bivalent vaccine? What happens if they show up and they're not sure if they get the bivalent one? If you could just kind of clarify, if somebody makes an appointment, for example, for next Tuesday, thinking that their pharmacy is going to have the bivalent vaccine, should they expect that that'll be the case, or they only get it if there's an invitation? If you could just explain that for us.
So just to clarify, we will not, given the size and the capacity we're trying to create at this point, it's by invitation only. And when you get your invitation, we will assume that you will want a bivalent vaccine if you're eligible. So if you're 18 and over, that would be the vaccine offered. But if you get to the clinic or the pharmacy and you want to have the regular vaccine that you've started with, that's fine as well. If you don't want the bivalent, as I said, and you would like to get your fall booster with a Novavax or potentially a Janssen, you're 18 and over, that you have to do through the call center. But we are assuming that the majority of people will want the bivalent. That will be sort of the default vaccine. But all of the regular vaccines are also available on an ongoing basis. And as Dr. Henry said, if you've never been vaccinated, the regular vaccines we've been using for the last 2 years are the vaccines that would be used for that primary series.
Second question for Dr. Henry. I know that you've been reluctant to reintroduce public health measures, but you're also worried about the fragility of the healthcare system and the fact that we could be facing a double whammy with influenza this year. So I'm just wondering, is it a metric of deaths due to COVID? Is it a matter of hospitalizations due to COVID plus flu? What are the numbers that you're looking at before you actually consider reintroducing public health measures to control potentially not just COVID, but potentially also the flu as well?
Really good question, and there's no one single thing. And we talk a lot about what we're following, what we're looking at in terms of what's transmission in the community, outbreaks, who's getting sick, who's getting hospitalized, the impact on healthcare workers and the system. So it is a little bit of everything. But I will also say that the pool of people who are susceptible is different now, and that's because of the level of immunity we have from infection and also primarily from vaccination and the combination. So the tools that we used when we had no immunity and where we needed to take drastic measures to slow down the spread of the virus are no longer, in some cases, effective and are no longer needed for the most part. So doing a mandate, making it a legal requirement for people across the board to do something is actually it's a last resort tool that we use very judiciously in public health. So I don't see us getting there unless we have the emergence of something very new and different where we have that susceptibility again. We know how to deal with a lot of this. We know that ourselves, all of us have had experience with this virus now. Schools know how to deal with it. They've understood the disruptions that some of the temporary measures that we had in place, like cohorting and distancing and mandates, mass mandates, the impact that they have on disruption of learning in schools. But we also know there's some things that we need to keep doing, all of us, paying attention to ventilation in indoor spaces, paying attention to cleaning, paying attention to our health awareness. How am I feeling today? Do I need to stay away from others until I feel better? And staying home if we're ill, hand hygiene. Those are the things that we can't ever lose. And I hope we're baked in. But we can trust people now, I think, in our community to do those measures. We don't need a heavy hand of putting in legal restrictions, in my opinion.
Our next question is also in the room. Please go ahead.
Hi, my question will be for Minister Dix en français, s'il vous plaît. Thank you so much. So I'll just need a couple of words en français sur cette campagne de vaccination en plein dans la saison de l'automne. À quoi ça va ressembler? Et quelques mots, nous dire à quel point c'est une campagne importante. Dans l'optique où on le sait, il y a le vaccin bivalent en ce moment approuvé par Santé Canada.
Et nous vivons toujours dans une pandémie qui a une influence sur beaucoup d'éléments de notre société, en particulier notre système de santé, mais déjà un peu partout. La vaccination, c'est un outil pour nous de répondre à cela. C'est pour chaque personne une opportunité de se protéger, de protéger ceux qu'ils aiment et de protéger la communauté. Nous avons des nouveaux vaccins. Et ce sont des vaccins qui sont efficaces contre les variants d'Omicron. Et donc, il faut, je pense, que tout le monde, dès qu'ils sont invités, de se vacciner pour cette période de l'automne. Je pense que c'est essentiel. C'est important pour nous comme société, mais c'est important pour chacun d'entre nous. Donc, et c'est pour cette raison-là que nous avons mis en place des effectifs importants partout dans le système. On va avoir à peu près 2 80, ce qui est quand même extraordinaire. En plus de tout ce qu'on fait maintenant dans le système de santé, on fait plus que de chirurgie maintenant que jamais avant. On fait plus de visites pour la santé primaire maintenant. Mais en plus, on va avoir une campagne qui, chaque semaine, va pouvoir vacciner à peu près 280 personnes, ce qui démontre la priorité qu'on donne à cet effort. Et je pense la priorité que chacun d'entre nous va donner à l'effort, c'est-à-dire quand on est invité à être vacciné, d'être vacciné.
Did you have a follow-up?
Merci beaucoup. Deuxième question, toujours en français, c'est-à-dire, Dr. Henry parlait du pic qu'on s'attend à avoir possiblement en novembre avec la COVID-19. On le sait à quel point les hôpitaux ici en Colombie-Britannique sont sous pression. On a vu entre autres des fermetures, des réductions des heures dans les urgences de la province. D'abord, est-ce que vous êtes inquiet par cette éventualité de voir un pic avec la présence de l'influenza? Et qu'est-ce qu'on pourrait voir? Est-ce qu'on pourrait voir deux mesures? Donc, en deux parties, s'il vous plaît, la réponse.
Et en août 2020, en août 2021, en août de cette année, on a fait des préparations pour l'automne et pour l'hiver. Parce que ces préparations sont essentielles, pas seulement pour la santé publique, mais pour tout le système de santé. Donc, je suis toujours inquiet. Je suis toujours inquiet. Parce qu'il y a des choses qu'on sait bien, puis il y a autre chose, toujours. Il y a toujours des surprises, et le COVID-19 nous a donné des surprises chacun. On se souvient quand même qu'en hiver dernier, en décembre dernier, il y avait le développement d'Omicron qui a tellement bouleversé tout le monde. Donc, on a fait des préparations. Mais j'ai beaucoup, je pense, de respect pour nos professionnels dans le système. Et on va être prêt pour répondre à tout cela. Maintenant, aujourd'hui, ce mois-ci, on a fait plus de chirurgie dans ce mois que jamais avant. Plus de tests, plus de visites, plus d'appels à l'ambulance. Et le système de santé a répondu à cela malgré tous les défis et les difficultés. Il y a certaines salles d'urgence, en particulier Clearwater, mais aussi à Mackenzie, à Chetwynd, qui a dû réduire leur service depuis quelques semaines. Et ce qu'on cherche et ce qu'on travaille, sur cette question, sur laquelle on travaille beaucoup, c'est d'avoir une réponse permanente à ces situations. Mais je pense que le système de santé va être en mesure de répondre, mais il faut que tout le monde y participe. Tout le monde est vacciné, qui sont invités à être vaccinés. C'est essentiel pour nous tous, pas seulement pour le système de santé, mais pour notre propre santé.
Sur les mesures, vous n'avez pas répondu. Les mesures, est-ce qu'on va avoir d'autres mesures?
Mais je pense qu'il y a de la préparation, n'est-ce pas? Mais les mesures, ce qu'on a fait depuis le commencement de la pandémie, c'est d'adapter aux circonstances. Et c'est différent maintenant. 92% sont vaccinés dans la population. C'est différent que l'hiver 2020. Mais on est toujours prêt à faire ce qu'il faut faire. Et le docteur Henry a démontré cela depuis 2 ans et demi. On est prêt à faire ce qu'il faut faire. Mais ce qu'il faut faire a changé aussi. Et donc, on va maintenant, et c'est pour cette raison-là, qu'on a une telle campagne de vaccination pour l'automne et pour l'hiver. C'est pour qu'on puisse faire ce qu'on veut faire pendant cette période, n'est-ce pas? Que ce soit à l'école, que ce soit dans nos vies privées, que ce soit au travail. Donc, être vacciné, ça veut dire beaucoup sur ce qu'on doit faire cet hiver.
That's all the questions we have for today. Thank you.
Merci, thank you.